Listener-supported St. Gabriel Catholic Radio AM 820 brings you Family Sanctuary, a show that inspires living the gospel message in word and deed within our families. And now, Family Sanctuary with host Peggy Hartshorn.
Welcome to the Family Sanctuary on St. Gabriel Catholic Radio. I'm your host for today's program, Peggy Hartshorn, Chair of the Board of Heartbeat International that advances life-affirming pregnancy help around the world. And I have a particularly interesting guest today. I'm so excited to do this interview and have you meet our guest, Dr. Lindsay Rarico, because we're going to be talking about a subject that's so near and dear to my heart, and I know is just so crucial today that we understand more about true women's health care and about the dignity of women and the beauty that God has created in our gift of fertility, our womanhood, and how that is not being honored and appreciated today, particularly in the medical field. So I think you'll learn a lot from this presentation today, and hopefully be inspired by a beautiful vision of womanhood and of women's healthcare. True women's healthcare. So I'm excited to introduce our guest and let her share with you even more, Dr. Lindsay Rarico. Welcome, Dr. Rarico.
Thank you so much for having me. It's just a treat to spend this time with you.
Mm-hmm. Well, it's a treat to have you and be sharing with our listening audience. Dr. Rarico is a board-certified family physician with a specialty in obstetrics. And she's been practicing as a board-certified physician here in the Columbus, Ohio area for about 15 years now. She's the staff physician with FEM. And on our program today, you're going to be learning more about FEM, which is a practice that specifically works with women and women's fertility. And she's also a physician at Westerville Family Physicians. And she and her husband are members of St. Michael's Parish, and they have 4 young children. So what a beautiful combination. And so Dr. Rarico, the focus of our program today is on a program called FEM. And we're looking at a new way of looking at women's healthcare, a new way of looking at women's healthcare that's called FEM. And first of all, tell us what FEM stands for, F-E-M-M.
Yes, so FEM stands for Fertility, Education, and Medical Management.
Okay, fertility, education, and medical management. So we're looking at our fertility, particularly as it's demonstrated in our monthly cycle.
Yes.
All right. We're looking at our fertility as a way of managing our total health care.
Absolutely.
Yeah, that's a very exciting concept that every month women have a cycle that their bodies experience that is not just something to be either hated or ignored or put up with, tolerated, or whatever, but to be seen as a gift in us, not only understanding that someday we will be able to have children, but also as giving us signs for our overall health. So explain how that works, would you?
Absolutely.
How do we know more about our overall health just from our menstrual cycle?
So our cycle gives us monthly feedback on how we're doing with our health. This cascade of hormones that have to occur each month for us to ovulate, which is really kind of the key point of the cycle. It's a very delicate system. So stress, illness, a number of other things can disrupt the cycle. And so this can, for women, be the first sign that something's wrong before they have other symptoms, before they're in to see their doctor. They can tell from their cycle what's going on.
If they're paying attention.
If they're paying attention, right. So often the myth exists that, if a woman has an irregular cycle, that she is just always irregular. This is my normal. And what we want to educate women on is that this is not normal. This is your body saying, help, like something's going on and we need attention. So this is something that can be applied during the entire continuum, the ovulatory continuum from puberty until menopause. Our body is giving us these signs. And so as early as those pubertal years, we want young women to understand what's going on so they can be on top of their health right away.
Sure. what should a regular menstrual cycle look like? By irregular,
Excellent question. Right. So what's regular? We have to start there. So a woman should have a cycle lasting from 24 to 36 days. They should menstruate from 3 to 7 days, with a few of those as moderate or heavy.
At the end of that cycle.
Correct.
Yes.
At some point in the bleeding. So
Okay.
if you have a cycle from day one of one period to day one of the next that's shorter than 24 or longer than 36, you could have one on occasion. But if you start to see that as a consistent pattern, 2 in a row or 3 over the course of 12 months, that should be an
Or
alert
totally
to you.
skipping
Exactly.
cycles.
Absolutely.
Having no cycle at all.
That's not normal.
in a month.
That's
Right,
not normal.
right.
And so oftentimes women go to their doctor, whether that's pediatrician or family doctor, OBGYN, and they're put on something to regulate their cycle. So they're given the birth control pill. But we are saying, hold on, don't take that step necessarily, because that's a Band-Aid, and we might miss an underlying diagnosis that could cause repercussions for your health down the road. So tracking your cycle is the first place to start with that. So when we say fertility education in our name of our organization, this is just learning how to chart those biomarkers.
Well, before we get into that charting, because I know that's very, very important, I want to stop again and emphasize that it is true when young girls start their cycles that they may have some irregularity. I mean, it may take a while to become regular, let's say, but if they have maybe severe cramping, or they have they skip months entirely, or even have a painful periods. It's so common for a doctor to put them on the pill. It's just, and I know that from pregnancy help centers, of course. The pregnancy help has been our work, my husband's and my work for many, many years. And we see so many girls in pregnancy help centers that have been put on the pill because of irregular cycles, or because of heavy bleeding or pain or whatever. And you're saying, obviously, that could be covering up a medical problem that they have.
Correct.
But of course, the other thing that it does is it causes them to have additional issues and problems simply from being on the pill. That sometimes causes them to stop taking the pill. Meanwhile, perhaps they've gotten involved in sexual activity because they've been on the pill and think they're safe. And so we see them for a variety of reasons. They hated the pill. It made them feel sick. They stopped taking it. Now they think they could be pregnant. And meanwhile, they may have, even if they're not pregnant, some medical issues that were covered up initially by the pill. One of the problems we have in pregnancy centers is knowing, how do we help these girls if they're not pregnant, so that they're not going to just immediately go back to their sexual activity and still have perhaps the physical issues and problems that cause them to have the irregular periods in the first place. So for us in Pregnancy Help, FEM, it is a gift. It's phenomenal because we're seeing women all the time who don't understand their periods, have been put on the pill to cause them to be more regular in their periods. And that's led to all kinds of negative consequences for them. So that's what particularly interested me in FEM. It's just, I know the value of it and the importance of it for young girls and women today. And when they're put on the pill, actually what that does is it just kind of flattens out their cycle. Is that correct?
Yes.
Their hormone changes, the normal hormone changes they're supposed to have are just kind of flattened out, correct?
Absolutely. It gives the body a new blueprint to follow of what should be going on at the level of the ovary. And instead of having the normal healthy fluctuations of estrogen and progesterone, and these are vital years in the teen years to get these healthy hormone levels for brain development. We're learning more all the time about neuroplasticity in the brain, and that window closes at 18 to 20. So if for whatever reason things were suppressed, if they didn't have a period on time and it was very delayed for whatever medical reason and it's not uncovered, they're losing actually scores in math. So they study
Wow.
these kids in college and they're not doing as well as their male peers or their female peers that received healthy hormone levels, natural hormone levels in their brain. So I think that's a good point to bring up with parents, right? When they're talking about cycles and periods and pills, that hormones are really vital for their daughters' brains.
The natural hormones,
yes,
not putting in artificial hormones and not flattening out the normal
correct.
Hormone cycle.
Not to mention side effects, which we see with young women, and this is well published, the rates of depression that go up with the pill. That's a very common side effect.
Mm-hmm.
So maybe she was using this for one reason to regulate her cycles, but now she has depression, she's had weight gain.
Right. So we're talking about some of the negative side effects of the birth control pill, of the birth control pill as it's used to and it doesn't cure these menstrual cycle issues at all. It simply covers them up. Yep. But as it's used to do that, and then even as it's used for spacing children for married couples, it does have some major negative consequences for women. So let's just review those for a minute. If we don't have FEM, if people aren't aware of FEM, and FEM can also be used, tracking your cycle and understanding your cycle, can also be used for spacing children.
Yes.
So one of the big benefits of that, of course, is that it's totally natural.
Yes.
Right?
Right. No side effects.
No side effects. And putting aside our faith-based interests in this, of course, as Catholic women, and we're very interested in this because, of course, it also is what our church teaches.
Absolutely.
Yeah, that if we understand how our body is created and that beautiful plan that God has for our fertility, we can cooperate with that fertility in having children and in spacing our children. And so FEM meets that criteria for us from a faith-based perspective, but also from a medical perspective. Let's review again some of the negative consequences of this hormone focus that we have in women's health today. Putting girls on the pill to cover up issues and problems in their cycle, and then using it as a major means for spacing our children. Let's review some of the negatives.
Absolutely. So some of the more common side effects would be depression, a decrease in libido. We've seen an increase in cancer. And for those people with migraines, it can make migraines worse. So a lot of them don't even have the option to take hormonal contraceptives. For people who have intrauterine devices, a lot of abdominal pain, irregular bleeding, and expulsion even, or uterine perforation. So these aren't always safe options for women to take.
And that's what the pill. What about the implants? Those are very common now, right?
Right.
Because, of course, providers that are pushing these hormones say, well, not everybody will take their pill at the same time every day. So now they're even implanting devices that deliver those hormones.
Correct. And with the side effects in those cases, they have now a device that they have no control over, right? They can't remove this from their arm. They can't remove this from their uterus. And so in a way, they have this kind of temporary sterilization that they have no control over. Whereas if they're having side effects from a pill or a shot, they can just stop. They can make that choice to stop because of the side effects. But if someone's put this in their body, I've had women come to me, they can no longer go back for whatever reason, insurance or their provider's telling them no, try to stick with this longer, where they can't get their device removed. And so I help them with that.
Wow.
Because that's their body. And if they're having side effects and they don't want to be on a treatment any longer, they should be able to stop it.
That's scary. Seeing the effects of that as a caring doctor like you do must be very difficult. Well, I would like to reintroduce our guest today. You're listening to Dr. Lindsay Rarico, who is a board-certified family physician and with a specialty in obstetrics. And right now, she's the staff physician with FEM, F-E-M-M, which we're talking about today, as an alternative really to the hormone-based family spacing philosophy we have in secular medicine as today, as well as using those hormones as the major treatment for any irregularity in a woman's menstrual cycle, which is covering up often a physical issue that needs to be taken care of. We're going to get into that a little more as our program continues. But Dr. Rareco, thank you so much for being with us and for your expertise. We're talking about FEM. Let's say again what the acronym stands for.
Yes, fertility, education, and medical management.
All right, good. One thing we haven't talked about yet is how do we help women actually understand more about their cycle? What you call charting, okay? Just explain a little bit what that is, and isn't that is kind of the first step for women to understand whether they're having a healthy cycle or not?
Correct. So charting is a way of keeping track of the biomarkers of the body. So specifically with FEM, charting their bleeding days. So what level of bleeding they're having, they can mark that down on their chart. And we actually have an app, so it's not a paper chart any longer. They can download it for free on their Android or iPhone. And then on their days after their period, they're often dry days. So now we're talking about cervical mucus. So they can observe this externally, and they can know that their days of dryness are typically progesterone dominant days. These are infertile days. And then middle of the cycle, maybe 14 days after their period begins, roughly, they start to see signs of fertile mucus. So increase in estrogen brings water to the mucus, and so they see moisture, and they see a change in that mucus that indicates the rise of fertility. So they can chart and keep track of all of this, and then they should see an abrupt end to that fertile mucus, followed by several days of dry patterns, and that indicates that they have ovulated. Now they're in another progesterone dominant phase, which is the luteal phase, a time of the stability of the lining of the uterus, a time for implantation if they're trying to conceive, and then their period should come again. So it shouldn't be a matter of bleeding days and not bleeding days, kind of how we've all learned in a secular way how to watch our cycles, but now bringing in
Natural body changes.
Yeah, to show the signs of ovulation occurring. So really, that's the culmination of the entire cycle, is that ovulation.
That was God's plan. The whole culmination. Now we've got an egg that could be fertilized, and we could have a baby.
That's right. This is the point of all of it. And when you can understand, like, what's the goal of this? Everything else makes sense.
Isn't it a beautiful thing? I love explaining the menstrual cycle to girls in pregnancy centers because often no one's ever explained it to them. They don't understand what's going on that month.
Right.
And I always remember that my mother used to chuckle because her mother always called it the curse.
Right.
You know, imagine when women really, truly did not understand at all what was happening in their bodies, and the benefit we have today of seeing the beauty of this. I mean, it's just so beautiful. And all culminating in only a few days during the month where a woman can become pregnant, but that our whole body clock is geared to that beautiful opportunity, you know, and we'll be talking a little bit more about, of course, God's whole plan for that. As I'm going to have another program with Dr. Rareco too. We'll be talking more about the dignity of the woman and the beauty of God's plan for us in His whole plan for humanity. So all right. So women can actually observe these things and chart them, even in an app on their phone. And then when it's not normal. There are certain signs. Then if they are under FEM care, all right, a doctor can help figure out what could be causing this. Why are you not ovulating, for instance?
Absolutely.
Or why is the menstrual cycle maybe too much bleeding is occurring? And what can be some of the reasons for that you need to treat?
I would say some of the common reasons that we see, just like health in general in our country, we see an increase in obesity, prediabetes, and diabetes. And so high blood sugars or insulin resistance can really affect a woman's health and her cycles. They have too much estrogen, they stop ovulating, they have these irregular periods, infertility. So we see a lot of that, unfortunately, even in really young women who you think, gosh, they couldn't have this already. So we are seeing a lot of that.
It's so important to know that before it does so much damage to your body.
Absolutely. So we're catching things early. We're treating it early before they have diabetes. We see issues with the thyroid. So low or high thyroid affect the cycle. prolactin issues. So that's another hormone that plays a big role in ovulation. And then PCOS. So people have maybe heard that or not heard that before, but that's polycystic ovary syndrome and often has to do with elevated male hormones. So those would be probably the most common things that we see as causes.
And those can be treated.
Absolutely.
Right. Bringing women back not only to a more regular cycle, of course, but feeling better all over.
Most definitely.
Absolutely. And those sound like serious conditions that if you let them go, could really be difficult for women coming into their 20s and 30s and 40s and never having been diagnosed with those issues.
Correct.
Yeah. So one of the things we ought to point out is that we're very fortunate in Columbus to have a FEM clinic where Dr. Rerko works. femhealth.org is the website where you can make an appointment in that clinic, or you can call the phone number 614-360-9995. Okay, 614-360-9995. We're very fortunate to have a FEM clinic here. But many, many women, in fact, most of the patients of FEM are served with telemedicine. Is that correct?
Absolutely. We are an international organization. We have FEM doctors in every corner of the world. And that's probably the best way for women to reach us and find us is through telemedicine. So that can be accessed on the website as well to see if there's perhaps a FEM teacher to learn how to chart or a FEM medical provider to get that medical care through our website.
I'm just thinking about mothers and daughters. So many mothers, as their daughters are coming into puberty, and maybe they're wondering, this doesn't seem quite normal at this point. Maybe she's having issues and problems. So do you work with mothers and daughters? Is that something you do?
Yes, definitely. I have a lot of patients that are moms and daughters. It's
Good.
wonderful.
Good.
And just knowing that health history, of course, you can see it repeat itself. And so that is helpful to take care of the entire family. One of the things I love about being a family physician. But one way for young girls to just kind of be introduced to all of this is our teen FEM program. So learning how to chart from that kind of teen perspective. They have a different need and just another different type of verbiage that we need to use with them and teaching them about charting.
And is that done online?
We can do that online, yes.
Wow. It's a course they take online? Okay.
Yep. So it's multiple courses. Usually we do an hour of like a PowerPoint with them at a time, and same for the adults, so that they have a month of chart practicing so they can get a feel for what's going on in their body, come back with questions, and then further develop their knowledge of their health.
Okay, so moms and daughters could do that together.
Sure.
On the internet. Wow, that's fantastic. So this approach as well, once a woman understands her cycle, and you can use it for medical management, of course, as we've been talking about, and finding medical issues and problems that can be corrected and help you for the rest of your life by understanding your cycle. What about using this for planning children, let's say for married couples? Because I know some of our listeners may be familiar with methods of natural family planning, the Creighton method, couple-to-couple league, so forth and so on. Do couples also use FEM?
Yes,
to
absolutely.
raise their children? Okay.
So we would just fall under that same umbrella with those other wonderful fertility awareness-based methods, all using the same science, maybe different biomarkers, but all getting to the same place of understanding with hormone changes, with fluctuations in estrogen and progesterone, where ovulation is occurring. And so, yes, couples can absolutely use this to understand their fertile window, when to try, when to avoid, based on their family goals at that time. And they can take this class together. In fact, I love doing the classes with the couple, and some couples will even kind of assign the husband the tracking. So he'll keep the app on his phone, check in with her at the end of the day and ask, what was your fertile sign today? And so keeps the conversation open. They're both really engaged in her care. And I love when the couple comes together for that care.
Yeah. I've heard so many couples who use an NFP method talk about how really close they became as a couple, much closer and much more intimate in in managing their fertility and understanding the beauty of their fertility and helping each other, and how much more affectionate they also became with each other. So that's wonderful that FEM also has that, is an opportunity for that. So again, just to give the contact information for all of the online opportunities, classes, training, even learning to chart, finding out, having communication with a provider in your area who may help you if you think you do have a medical issue or problem. It's femhealth.org. Is that correct?
That's correct.
Yes. And then if you'd like to come in person to the Columbus Clinic, we do have a phone number, 614-360-9995. So it's just, I am thrilled to see the growth of FEM. How long ago was it founded, Dr. Rarico? Do you know?
I jumped on about 8 years ago.
About 8 years ago.
Was there a few years before that. So
Yeah.
it's going strong and just growing in a beautiful way.
That's a beautiful thing. Something that is so powerful, natural, according to God's plan, and brings about such positive results in terms of good medical health for women, as well as opportunities to follow God's plan and understand how beautifully He made our bodies. It's lovely.
I'm so glad to be a part of it.
Well, thank you, Dr. Rarico, for being our guest today. And you have been listening to The Family Sanctuary on St. Gabriel Catholic Radio with your host, Peggy Hartshorn. And archives of our program are on stgabrielradio.com, and we're streaming live on stgabrielradio.com. Our program is broadcast at 4 o'clock every Saturday and 2 o'clock every Sunday. So please join us again to strengthen our families and make them the sanctuaries of life that God intends.
Family Sanctuary is a production of listener-supported St. Gabriel Catholic Radio, AM 820. Archives of Family Sanctuary with Peggy Hartshorn are available at stgabrielradio.com.